Depression and anxiety are incredibly common in general practice, and particularly looking at comorbidities. We see people with chronic conditions like diabetes or heart disease often presenting with associated mental health conditions too, particularly depression and anxiety. Statistically, it's anywhere between 25 to 90% of the demographic of people with those sort of conditions that you might see in practice. And we know that exercise can be really beneficial for managing anxiety and depression, but the key is how do we approach that with the patient to get the biggest impact. And there are a few really important considerations. So the general population guidelines still apply. We still want to try and progress a person through towards the 150 minutes of moderate to vigorous activity during the week with no more than a couple of days off in a row. The frequency of exercise is going to be really important. But what's important to note is that aerobic exercise and resistance exercise can have very similar effects. So when we're dealing with people who have depression and anxiety, the important parts are initiation and maintenance of these behaviors. So you can give the patient a fair bit of agency when it comes to them choosing the type of exercise that they'd like to do. So you can be quite broad with the prescription, and that might come from the patient's history. If they've tried things in the past, or if there are types of activity that they do enjoy, we want to lean into those and give them those options. The effect of exercise for people with anxiety and depression can be really profound. So we know that people who are able to exercise regularly, so there's a nice little dose-response relationship. So if we can approach those guidelines of 150 minutes, then the frequency of anxiety episodes and depressive episodes is significantly less, and there is a small but still significant effect on the severity of episodes when they do occur. So the key to that is understanding that often people will think in the moment of, if they're feeling particularly anxious or feeling particularly low, it's very difficult to think, oh, I should do a workout. So sometimes the easiest thing is to encourage people to notice when they are feeling good and use those opportunities to find a bit of exercise. So there's a little bit of strategy there around reducing the barriers, because otherwise people feel like they notice at the time feeling anxious or depressed, and then they get more anxious or depressed that they didn't do the exercise in that moment, which is really difficult to do. So we want to make it easy for them and encourage them to find the moments when they do feel good to practice the behaviors and reinforce them, knowing that it does have that preventative effect down the track. So that can be really helpful, and then particularly if you are working with comorbidities, so people that have heart disease and diabetes, trying to guide the patient towards those guidelines as well for those specific conditions. But the initial implementation of exercise and regular movement is what matters most for people with anxiety and depression. And then some regular touch points, use of technology is really good. So whether that's smartwatches or online coaching programs, those sorts of things that can provide a bit of structure to remove any of the mental energy required to get motivated to move or to think about, oh, what should I do today? They know they have their plan there, and they know what tools to use. So when you are prescribing physical activity for those patients, really important to have the conversation with them. Find out what they like, what they've done in the past, where is the path of least resistance, and we start with that implementation there, and then refer them on to your exercise physiologist to maybe get a little bit more specific and come up with some other strategies that might be really beneficial.